Hello, and you're most welcome to the RCSI MyHealth lecture series. My name is Professor Steve Kerrigan, and today we are going to discuss living well with MS. The MyHealth lecture series explores a wide range of areas in health and well-being and brings together some of the leading healthcare experts in those fields, with the goal of empowering people with the knowledge to make informed decisions about their own health and well-being. Multiple sclerosis, or as it's more commonly known as MS, is an unpredictable disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. Today, I'm joined by Dr. Lisa Costello, consultant neurologist at Beaumont Hospital, Dublin, Dr. Claire McCoy, senior lecturer in immunology at the School of Pharmacy and Biomolecular Sciences, RCSI, and Ms. Grace Winters, finance director and MS patient, to discuss the clinical aspects of MS, the experience of living with MS, and what therapeutic advances is being carried out in the area. I would like to thank everyone for joining us today. Lisa, I might come to you first. Can you explain to our viewers what MS is and what causes MS?
Thank you for inviting me to be part of this series. MS is a chronic inflammatory neurological condition. It affects the central nervous system, so that can comprise the optic nerves, the brain, and the spinal cord. It's what we call an autoimmune condition. So this means that in autoimmune diseases, the body's immune system, instead of just fighting infection, it becomes overactive and starts attacking healthy tissue. In multiple sclerosis in particular, the immune system is attacking a protein called myelin. Myelin is a fatty substance that acts as an insulating layer around nerve fibers in the brain and spine. And when the immune system damages this, it's known as demyelination. When demyelination occurs, it means that the electrical signals between the brain and the rest of the body are impeded, and this can lead to a variety of neurological symptoms for a patient.
That's great. Thanks, Lisa. And what causes MS?
Well, it's probably no one thing that causes MS, and it's not fully understood, but we do know that it occurs because of an interplay between genetic and environmental factors. So it's not a genetic condition in the sense that it's handed on from generation to generation within a family, but we do know that people who live in certain parts of the world and are from certain populations, for example, Europe and North America, are more genetically susceptible to MS. The environmental factors that we know are risk factors for MS are low vitamin D and lack of sunlight exposure. We know that smoking plays a role, and also childhood obesity can play a role in risk development.
That's great. Thanks, Lisa. And who gets MS and how common is it?
Well, anybody can get MS, but it is much more common in women than in men. And some studies would say the ratio could be as high as 3.5 to 1 female to male. It rarely occurs in children or the elderly. The usual age of onset is between the ages of 20 and 40 years of age. It's relatively common. We don't have a national registry of patients, but we feel there's probably approximately 9,000 people living with MS in Ireland. And we know that in Ireland and indeed internationally, the numbers are increasing all the time.
Okay, and is it known why the numbers are increasing worldwide?
I think it's probably due to a number of factors. I mean, partly because there are thankfully more neurologists and more access to MRIs, that the diagnosis is being made earlier. And also with the advent of newer and more effective drugs, patients with MS are living longer. So I think there's probably a number of contributory factors to that.
Okay, and what symptoms most commonly experienced by someone who has MS? And what sort of problems can these symptoms create for a patient?
Well, MS is an unpredictable condition, and because it can affect any part of the central nervous system, there are a myriad of different symptoms that can occur in an individual patient. Typical symptoms would comprise a difficulty with vision, so either loss of vision in an eye or double vision, difficulty walking, mainly due to problems with either weakness or numbness or stiffness in the limbs. Brain fog or fatigue would be a very common symptom that patients describe. A lot of patients also will describe cognitive difficulties. And bladder and bowel dysfunction is also a prominent feature in some patients, but not all patients will experience all of those symptoms, and different people will have different symptoms at different times. And obviously any or all of those symptoms can impact on a person significantly in terms of their work or home life.
And what are the different types of MS?
Well, there are three main subtypes of multiple sclerosis. The commonest type is known as relapsing remitting MS, and about 85% of all patients who are diagnosed with MS initially will be diagnosed as or MS. This is typically characterized by what we call relapses or attacks of new symptoms that come on over a period of 24 hours and can last from days to weeks. These relapses or attacks are then followed by a period of remission, which is a period of relative disease quiescence or improvement, though some people can be left with some residual symptoms from the relapse. The frequency and the timing of these relapses is quite unpredictable and will vary between individuals and even within the individual themselves. Over decades, patients with relapsing remitting MS may go on to transition into what we call the secondary progressive MS phase, and this is the second subtype of MS. This is no longer characterized by relapses and remissions, rather than by a slowly progressive problems with mobility that gets gradually worse over years and can be associated with other features, including bladder dysfunction and cognitive difficulties. The last subtype of MS is called primary progressive MS. This occurs de novo in about 15% of MS patients, so it's a less common subtype. It is characterized by a slowly progressive decline in mobility from the outset rather than attacks and remissions, though these can rarely occur.
That's very interesting, Lisa. And are they treatable?
Yes, MS is a treatable condition. It's not, unfortunately, at present curable, but we now have drugs that modify the course of disease over time, and we call these disease-modifying drugs, or DMTs. For relapsing remitting MS, there are about 14 licensed DMTs. For secondary progressive MS, there's one agent licensed, and from primary progressive MS, there's one agent licensed. So these DMTs reduce the number of relapses a patient has and therefore reduces the amount of accumulating disability over time. And for the more progressive patients, it can slow the rate of disease progression. In addition to disease-modifying therapies, we also have many drugs that can treat the various symptoms of MS. And I think it is also important to state that MS treatment takes place as part of a multidisciplinary team. So not all the treatments are drug-related. We also have a myriad of other allied health professionals that may engage with the patient at any given time, depending on their care needs.
That's really interesting. And you mentioned about multidisciplinary teams. What do you mean by that?
So I suppose there are multiple healthcare professionals that will be involved in the care of an MS patient over the course of their lifetime, and they may not access all of them at one time, as care needs will change over the course of the illness. So the neurologist is just one part of that, actually. I mean, we have obviously a role in diagnosis and treatment and monitoring of treatment, but there are many other people involved, for instance, physiotherapists, occupational therapists, speech and language therapists. The MS nurse is a critical part of the team and often a very close liaison person for the patient in accessing their physicians. And then there are several other people that can be involved over time, urologists, psychologists, and so on.
That's great. And what are the treatment challenges?
Well, I think the treatment for MS patients needs to be very individualized, and it will very much depend on the type of MS the person has, their disease activity, and what other medical problems they may have as well. Safety is always of paramount importance. So when we're using drugs to treat MS, they suppress the overactive immune system, but in doing that, they may also make patients more prone to infection. So it's very important that we monitor patients for signs of that by using, regular blood tests and MRIs and so on. I think compliance or adherence to medications can often be an issue in any chronic illness, and it can sometimes be difficult for patients to remain motivated to take medications, particularly if they feel they may have some side effects depending on the agent. Family planning is always a consideration in women of childbearing age, and this is something that we discuss very regularly in the clinic, and this may influence which drugs we use at which time. And then obviously we have a lot of drugs for relapsing MS, but there's a relative dearth of drugs for the more progressive forms of disease. And I think this is really the holy grail of MS therapy and is the big challenge that we all hope that there will be drugs in the near future that can promote repair and reverse disability rather than just dealing with inflammation.
Okay, thanks for that, Lisa. That was very insightful. As I mentioned earlier, MS is often unpredictable, meaning that what each patient goes through could be different. Lisa has invited one of her patients here today to talk about her experience with MS. Lisa, would you like to introduce Grace?
Yes, it's my pleasure to introduce Grace Winters. Grace is a person living with MS and she attends my clinic in Beaumont Hospital, and she's kindly agreed to share her story with us today.
You're very welcome, Grace, and thank you very much for taking part in our discussion today. Can I ask you to describe to our viewers what your experience of living with MS has been like?
Sure, Steve. So I have been diagnosed with MS for 2 years now. And what prompted me to go to the doctor about it was I had a really busy week at work, and I noticed that I was feeling limp on one side, quite numb. Completely then it went through my entire right side. But what was most concerning was on the Thursday and Friday of the week, I actually got double vision. And I had planned to travel with work on the Sunday. I was due to go to Portugal, and I said I better do something about this. So I went to the doctor. Needless to say, the doctor sent me straight to the hospital, and I was very fortunate that the hospital, looked into my situation. They performed a CT scan, and they admitted me straight away. Needless to say, initially, I didn't get a diagnosis of MS. However, it was quickly to follow. So at first, it was described as I had numerous white spots on my brain. And obviously, we didn't know what this was. So the medical team prompted further into the issue, and they'd done numerous other checks to see if there was anything else at bay. So fortunately, I was under the care of Dr. Lynch in the Lourdes Hospital, and I was very fortunate then that Lisa was attending the Lourdes Hospital on the Monday. So for that period of time, we didn't know what it was. So you can imagine, right? There was all sorts of things going through our mind. Was this cancer? Is it a brain tumor? Was there a bleed? All these sorts of things. And, when I got told on the Monday that it most likely was MS, I had a complete sense of relief. My entire family had a complete sense of relief. I have two adult children now, and needless to say, they were very, very upset, and they were doing their own research. So when we actually got the diagnosis, we actually had a party around the hospital bed to celebrate. What I will say is initially I had no pain. There was no pain at all. So I was like, I'm not sick. Why am I in here? But obviously the double vision and the numbness had to be dealt with. So that was dealt with pretty much straight away, and I got released within the week, which was very good. What I'd say is the first 6 months was quite challenging in terms of I wasn't able to do what I always done. So during that time, I was working with Lisa, and she was outlining all the different treatment plans that was available to me. And within 2 months, I had commenced my treatment. So the treatment that I'm on is Fingomed. I'm not pronouncing that right, but I'm sure Lisa or Claire will clarify that for me. But I'm on that treatment. And shortly after that, I started to experience severe headaches and migraines, and they were quite debilitating. So we had to go and we had to look at that and address that. So I then got, fortunate enough, it was addressed very quickly. I got a new treatment to address the headaches and the migraines. As you can imagine, as a finance director, it's something I couldn't live with. However, then once the first 6 months have passed, Steve, really, it has a very limited impact on my life. Very limited. I am fortunate enough to be under the care of the Beaumont team and Lisa herself. So quite honestly, I attend Lisa twice a year, and I get an MRI scan once a year. And here we are today.
That's great, Grace. Thanks very much. And what impact has it had on how you live your life right now?
In terms of how I live my life right now, quite honestly, it's no different to how I lived my life before MS. I have a couple more medical appointments. What I will say, it's not all roses. We do have to deal with days where I might have a migraine, or days where I'm really, really tired, as a result of fatigue. The odd day that I have brain fog, but quite honestly, that has been no real impact on my life. It's nothing more than a headache that we would have experienced before. I'm back in my job. I was only out for a number of weeks when I was diagnosed. I'm living life to the fullest.
That's great to hear, Grace. So what resources, tools, or coping mechanisms have you used that you have found to be beneficial to help you live well with MS?
The first thing I'd say on that one, Steve, is really down to the MS nurses in Beaumont, okay? You know, anytime something different happens, I tend to give them a call, you know, just to understand, is this MS related, or am I just imagining things? And they're at the other end of the phone all of the time. They're a fantastic resource that's available to MS patients. What I would say incremental to that is I have an app that I put on my phone. It's called MediSafe. I live by that app. I look forward to every day when that app dings on my phone, because that's when I take my treatment. And that's how I know that I'm going to continue living well in this space. I might add to that also, Steve, you know, exercise and staying as active as possible, not just from an exercise perspective, but active in your life, you know, the engagement with your family, you know, walking is my medicine. That's what works for me. But overall activity in your life should remain constant. And that definitely was key to success for me.
That's really useful information, Grace. Thank you very much for that. So what advice would you give to someone who's been recently diagnosed with MS?
The first thing I'd say is don't panic. What I would say is give yourself a bit of time. I would say make sure you take the advice of your medical team. You know, as I mentioned earlier, I have adult children and had when I was being diagnosed, and they were smart enough to know what resources to use. So, you know, follow like the likes of MS Ireland, Bart's blog, all recommended platforms to seek advice and guidance and support from. So what I tend to say is MS is a passenger that I have to carry for the rest of my life. So I do my best to shove it in the boot of the car.
That's great. Thank you very much, Grace. Moving along to Claire now. So we have learned about the effect MS can have on the body. So looking to the future of MS, what is currently being done to learn more about the disease?
Hi, Steve. Thanks for having me here to chat. So as Lisa had said, we currently don't know how MS is really caused. So from a research perspective, we're really keen to understand more about the disease, because the more we know about it, then the more ammunition we have and the more capacity we have to develop new therapeutics to try and understand how we can cure MS or even prevent MS from even happening. So that's where we're currently trying to learn. Another aspect that we're really trying to understand in MS is how the immune system plays such a critical role in this disease. So what we do know is that our immune cells, or they're more commonly known as white blood cells, is that our immune cells cross into the brain and the spinal cord with someone with MS. And what happens in a patient with MS is that these immune cells become really agitated and they start releasing these inflammatory substances. And this leads to pockets of inflammation in the brain and spinal cord. And it's this inflammation that then leads to the myelin damage that Lisa was speaking about. So what we really want to learn is why the cells get into the brain and spinal cord and how they actually are triggered to even enter the brain and spinal cord and become agitated in the first place. Then we can really begin to understand how to stop that and stop the inflammation and stop the damage that occurs in the brain.
Oh, that's very interesting, Claire. Can you maybe tell us a little bit more about these treatments currently available and how these treatments are benefiting patients?
So yeah, as Lisa mentioned, there's 14 approved therapeutics in Ireland for relapsing remitting MS, and they all work to limit that inflammation that I was talking about that occurs by the immune cells in the brain. And they limit the inflammation in 3 different ways. So the first way they can limit the inflammation is literally to stop the immune cells entering the brain and the spinal cord. So for example, natalizumab and fingolimod work in this way. There's other therapeutics then which can actually stop the immune cells, that agitation state. They can stop them being so active. And interferon beta and glutamer acetate work like this. And then there's other therapeutics which actually work to deplete the immune cells in the brain. And so ocrelizumab and alemtuzumab work in this manner. So they all have the impact of limiting inflammation, and this reduces the relapses. This reduces the associated disability, and it also reduces MRI activity. So they're all fantastic. However, there does remain challenges with these treatments, and this is what interests me from a research point of view. So the first challenge would be they all, some of them can have unwanted side effects. So for example, there can be flu-like symptoms, there can be injection site reactivity. As Lisa mentioned, there can be contraindications for pregnancy. There can also be, risk with increased infection and secondary autoimmune diseases. So this is something that we really need to focus on and make better in advanced therapeutics. The second challenge is that 14 of those therapeutics work for relapsing remitting MS, and we only have one therapeutic for secondary progressive and primary progressive MS. So there's a real global effort to try and identify and really push better therapeutics for SPMS and PPMS. And the third kind of challenge from my perspective is that all the current therapeutics act to limit inflammation. And this is brilliant, and they're really effective at doing that. But we want to advance that and push it a bit further and develop therapeutics that can limit the inflammation, but also promote repair of the damage that's caused underneath. So we call this, as Lisa said, the holy grail of MS research.
Yeah, they're tricky challenges, Claire, to have to deal with from a research perspective. But certainly research and continued investment in research is critical for improving treatment and outcomes for those patients who are living with chronic diseases. Claire, really, as a researcher in this field, what does the future of treatments for MS look like?
So, Steve, this is a really exciting and a really promising area of research at the moment. I can't tell you, as a researcher, I know that around the world, there are so many researchers and labs really working together to try and identify new methods to promote repair in the brain. So the body actually has a natural capacity to repair itself, and the brain is no different. And so what we're trying to do across the world is repurpose old drugs or identify new mechanisms or new therapeutics to actually promote repair. And actually in my lab, we look at how the immune system can in itself promote repair. So I work on these cells called macrophages. They're my favorite cell type. I am biased, but these macrophages, we've actually shown them to limit inflammation and promote repair. And so that's the holy grail. It's fantastic. So we're trying to understand that mechanism and then try and promote or harness therapeutics to keep them in that state.
Well, that sounds very promising, Claire. We are running out of time, but before I close today's discussion, I would like to ask each of you for what your key takeaway message would be for the viewers watching this. Lisa, I might come to you first.
Yes, thank you, Steve. I suppose I'd like to say, I think some people may have historically had a negative view of what multiple sclerosis was like for an affected patient, but really the modern face of MS is very different. And there have been remarkable changes in MS care in the last number of decades. We have streamlined diagnostic pathways, we have access to more targeted, more effective drugs, and more recently we have for the first time drugs that are useful in patients with more progressive forms of MS. So I think the future for MS patients is very bright, and that there is a very active, robust MS research community in Ireland and indeed worldwide, and hopefully things will continue to improve in the near future.
Thank you for that, Lisa. And Grace, what would be your key take-home message?
While we wait carefully for all the work that Claire and Lisa continue to do in the research space, you can live extremely well with MS and have a very fulfilling life.
That's great advice. Thanks, Grace. And finally, Claire, what would be your key take-home message?
My take-home message would be hope. I really see a global effort in researchers trying to understand the cause for MS and trying to identify these really great new ways to improve patients' lives. In fact, in Ireland, we actually have quite a high prevalence of MS, but that makes Ireland a really good place to do research. And I'm really lucky to work with some fantastic colleagues across all the different universities in Ireland. We're actually established an All-Ireland MS Research Network, which will aim to focus and bring together clinicians, scientists, patients, MS nurses, all working together and to work collaboratively to really, with the sole mission to stop the progression of MS.
Thank you for that, Claire. There is some really useful information in there. So that concludes our discussion today. I hope you enjoyed the discussion as much as I did. My thanks to our panelists, Dr. Lisa Costello, Ms. Grace Winters, and and Dr. Claire McCoy. Links to any of the additional resources mentioned in today's discussion will be shared on the RCSI website. For the next event in the MyHealth lecture series, we will be joined by Professor Martin Seligman, Director of the Positive Psychology Center at the University of Pennsylvania. Professor Seligman, considered to be the founder of positive psychology, will deliver a guest talk on positive psychology, agency, and human progress, which will air on Tuesday, the 1st of June at 2 p.m. You can find out more information about this and other events in the MyHealth lecture series on the RCSI website. From all of us here at RCSI University of Medicine and Health Sciences, thank you for watching. Take care and stay safe.